I'll go there. Send me a friend request. Okay.
I sent it yesterday. We are live.
You sent it yesterday. Okay. No, I haven't looked at that.
No problem.
Okay. So even though he has Facebook, the utility is close to zero.
Yeah, just trying to equalize. That's what you're trying to do.
That's all. He uses to spy on his children. That's
could
about
you check
it.
if we are live, please? Could anyone check if we are live on Facebook, please? I think.
Okay. Let me see. Okay.
We are.
That's Samuel Latte.
Yes.
Okay, confirm request.
Right. So I'll tag you shortly.
Okay.
But yes, we are live.
Oh, we are?
Yep. If you would like to share, please share or tag a couple of friends. I've tagged you, Dr. Lai. I've tagged you, Dr. Anand.
Thank you. I'll have a look.
Tag you, Dr. Apalu.
Send me a friend request. Okay.
I sent one from Samuel Latte. Dr. Lai, I've tagged you, and Dr. Anand.
Thank you. I'll have a look.
Tag you, Dr. Apalu. I sent one from Samuel Latte. Dr. Lai, I've tagged you, and Dr. Anand. Thank you. I'll have a look. Tag you, Dr. Apalu. Right. I think someone is on Facebook and I can hear the feedback.
Yeah.
Are we all good now?
Yeah, we're good.
Yeah. Right. Good evening to our lovely audience. Thanks once again for joining us for tonight's edition of the Wisdom Conference, dubbed Time with the Doctors. Tonight, I'm really blessed and I feel really privileged to be surrounded by these lovely people. I'm going to ask Dr. Jonathan Lai to introduce himself first, then Dr. Albert Apalu, and then Dr. Nana Ado. And I would leave the best for last. Dr. Mrs. Anand would introduce herself.
So correction in the name will be Dr. Frank Ado.
Dr. Frank Ado, right.
Yes, Nanadu will be my nickname.
That's fine.
Okay, so as most people have seen me here, month to month, I'm Dr. Jonathan Lai. I'm originally from Ghana, but I'm based in Arkansas in the United States. I'm a colorectal surgeon and a professor of surgery at the University of Arkansas. And I'm glad to be here to help enlighten us on the topics that we have for today. Thank you.
Thank you. Dr. Albert Apalu.
Yes, hi, good evening or good afternoon, everyone. I'm Dr. Albert Apalu. I'm a neurologist and a strokeologist. And I work at the Korle Bu Teaching Hospital and a senior lecturer at the University of Ghana Medical School. I'm here to enlighten us about stroke and to throw more light on the menace of stroke.
Thank you very much. Dr. Frank Ado.
Thank you. So yes, my name is Dr. Frank Ado. I'm a cardiologist. I'm based in the United States. I come originally from Ghana.
Thank you very much. Thank you very much. And Dr. Mrs. Anand, could you please introduce yourself to us?
Hi, I'm Dr. Anand. I am from United Kingdom, and I'm a medical doctor who specializes in general medicine, and I live in Hampshire. Thank you.
Thank you. Right. So this evening, lovely audience, we want to give you the privilege and the opportunity to share this with your family, with your friends, with your loved ones, with your neighbor. Please tag someone, share it on a group, share it on a platform. This is going to be really educative. And to be honest, I don't know how I would have been able to get Dr. Apalu if not for Dr. Lai. And yesterday I did a bit of homework and I was told he's a very big man and a very busy man. And so is Dr. Frank Ado. as well as Dr. Lai, actually, and the woman of God herself. Every one of them is really busy, and thank you for making time for us this evening. Dr. Lai, you are going to give us an introduction. Why did you think it was necessary for us to do this topic today?
Okay, so today's topic is on, cardiovascular disease. So we are looking mainly at heart disease and stroke. And these are two conditions that are very common. And actually, in most parts of the world, they contribute to most deaths in any country. If you take the United States, for example, I mean, cardiovascular disease is the #1 leading cause of death, every year. And so it's a very important topic to discuss. And as we talk about stroke is very common in multiple parts of the world, and especially in the developing countries. And it's important for us to understand what these conditions are so that we can prevent them. And then also when they happen, we will know how to deal with them and make sure that there is good recovery, and then people can return back to their normal lives. And so it's important for us to discuss these topics. So I think it's going to be worth your while to be listening to this seminar.
Thank you very much, Dr. Lai. I've just heard someone comment saying no sound. So I'm not sure whether, are we all good? Could someone also double check? Because I went on Facebook and I thought we were all right, but I have Stella saying there is no sound and I'm not sure.
Hello. Yes, I think there's sound.
Yeah, there's sound.
I can hear everybody.
Good. So we are good. Stella, could you please check? Probably it's your end. So could you just double check? Maybe it means.
Maybe she's on mute.
Maybe you are muted or you need to increase your volume. So check it out, and Stella, could you? Thank you. Right, Dr. Frank Adu. So what is cardiovascular heart disease?
Yeah, so it's a question that comes up a lot. People asking what is cardiovascular disease, or simply put, heart disease. Basically, it's a disease involving the heart itself and the blood vessels connected to the heart.
Mm.
So when you talk about the heart, you pretty much, I like to envisage the heart, and every day, this is how I explain it to my patients.
Right.
The heart is simply like your house, okay? So your heart has a structure, and that structure, if you look, if you compare it to the heart, that is pretty much the heart muscle. So that is pretty much the heart muscle. In addition, you could have disease that involves the conduction system. That conduction system of the heart is analogous to the electricity that is going through your house. So the heart also has electricity. In addition, the heart has doors, right? And those doors are the valves. So just like your house has doors, you also have heart valves that communicate or allow blood to go from one chamber or one section of the heart to the next. The heart also has blood vessels. So the heart itself has blood supply. And that is, again, analogous to what you see in your house, pretty much the plumbing, okay? So heart muscle, the valves themselves, the conduction system of the heart, which is the electricity, and also the plumbing, which is the arteries that supply blood, the blood of the heart, okay? So now in this diagram, you can see all these blood vessels that are connected to the heart, because the heart is pretty much a pump that pumps blood around the body and sends oxygen to various parts of the body. And it's able to do that through the blood. So the oxygen is carried through the blood. Now, so that is how oxygen is going from one section of your body to the next. If you think about it, it is an elaborate connection of tubes. So when we say cardiovascular disease, not only are we talking about the heart itself, we are talking about these tubes that connect the heart to every part of your body, essentially. So you're talking the arteries, the veins, and the capillaries that go around. So that brings you to, you could also have disease of these blood vessels. Now, commonly around the world, which is what we like to focus on, is primarily hypertension. So blood pressure, high blood pressure, primarily disease of blood vessel. And then, of course, if you go into the brain, you're going to have disease, what we call stroke. Okay, so basically, when we talk cardiovascular disease, we're talking disease of the heart, disease of the blood vessels, and what we should not forget, it's also the blood itself that runs through the system is part of the cardiovascular system. That is why we end up talking about cholesterol, etc. And we'll talk about all that as we go down the pipe. So there's a lot of opportunity for disease because of how wide the surface area of the cardiovascular system is. It is said that the cardiovascular system, when you stretch out all these tubes, you are talking about 3 football fields. So if you can imagine 3 football fields folded up into tiny tubes is what sends blood around our body. And it shouldn't be a surprise that cardiovascular disease then becomes a leading cause of death and mortality or morbidity around the world, primarily because there's a lot of opportunity then for disease due to this very wide surface area that we are dealing with on a daily basis. So in brief, that is cardiovascular disease, what it means.
Lovely, thank you. Dr. Anand, so what are the symptoms of cardiovascular diseases and what are the risk factors?
Of cardiovascular. Thank you very much, Lady Maud. I'll start with, I think I'll start with the risk factors, and then I'll go on to talk about the symptoms of cardiovascular disease. So there are a lot of risk factors when we are talking about cardiovascular disease. The first one being primarily age. So as we grow older, our risk increases for cardiovascular disease. And apparently it triples with every decade from the age of 40. So when you're getting into your 50, your risk is tripling. And there's evidence to show that coronary fatty streaks actually start from adolescence. So as you're getting older, this is actually getting worse. And 82% of people who die from coronary heart disease are 65 years and older. From the age of 55, your risk starts doubling. And one of the reasons why age increases risk factors of heart disease is because your serum cholesterol level for most populations starts increasing. So that's why it's important to go and have your cholesterol checked. You know, as you're getting older, especially from the age of 40 here in the United Kingdom, you're encouraged to go and have your cholesterol checked. The second thing that affects that increases your risk of heart disease is your gender. So it's commonly in men that your risk is higher than in women. Women tend to be protected by their hormones, especially premenopausal women. Estrogen tends to protect us. But after you go through menopause, your risk increases to match that of men. Coronary heart disease is 2 to 5 times more common in middle-aged men than women. Men tend to be more at risk of coronary heart disease because of the fact that they tend to have what we call the apple shape, which is where they carry the fat distribution of their body tends to center around their abdomen. And because of that, they have what we call visceral fat, which goes around the organs of the abdomen, which one of them includes the heart. And because of that, they are higher risk of suffering coronary heart disease. The third thing that risk that we have is smoking. So if you smoke, you put yourself at high risk of having coronary heart disease. The nicotine puts you at high risk of having sediment in your arteries, which we call atherosclerosis. The disease process is called atherosclerosis. So they're basically plaques that form in your arteries. It's not just the people who smoke directly, but also secondhand smoking can also put you at high risk of heart disease. So people who live with other people that smoke, you need to be conscious of that, because you're inhaling that smoke, and that smoke will put you at high risk. So it's actually it gives you a 10% increase in your risk of coronary heart disease. Physical inactivity is a risk. So if you don't exercise, you are putting yourself at higher risk of developing heart disease. So you need to at least be having, it's recommended 30 minutes 5 times a week of moderate exercise, or you can have 20 minutes of active exercise. So something like walking, or just taking the stairs when you're at work, that helps to lower your risk of heart disease. But people that live a sedentary lifestyle put themselves at high risk. Also, physical activity will help with weight loss, which is also one of the other high risks of heart disease. So obesity, being overweight, you need to be conscious of your BMI, which is your body mass index. There's a way that it's calculated here in the West. If you go to your GP, they'll tell you what your BMI is. I'm not sure what the process is in Africa, but that's something that, if you know the ideal body mass index you need to be in, it helps you to at least be conscious and help to lower that risk of cardiovascular disease. Diet. It's always diet with your health. So high dietary intake of saturated fat or trans fats and salt, and a low intake of fruits and vegetables can actually really increase your risk of cardiovascular disease. It's very important to take our fruits. It's very important to take our vegetables, to increase your fiber in your diet. Because when you don't do that, then you're only setting yourself for the worst when it comes to your heart. And also the salt levels. I know for us, Afro-Caribbeans, we love our salt and our spices. You need to take care how much salt you're actually taking, because that can actually lead you to developing hypertension, which is another risk factor to cardiovascular disease as well. Alcohol intake. So alcohol is a bit of a dicey one, because there's a recommendation that small amounts of alcohol can actually protect you from cardiovascular disease. However, saying that if you do go overboard and you're taking it excessively, then chances are you're now tipping yourself the other way and actually increasing your risk. So personally, I would advise, if you can avoid the alcohol, avoid it. But for people that, prefer a drink, I think it's recommended, is it a glass of wine, red wine, to protect your heart? But obviously for us as Christians, that is not an option for most of us. The other risk factor is diabetes. If you are a diabetic, then you need to make sure that your diabetes is properly controlled. Diabetes naturally damages blood vessels. So as a consequence, that increases your risk of developing cardiac disease, or cardiovascular disease. Your risk for stroke goes up. Your risk for having a heart attack also goes up. Celiac disease. For those of you that don't know what celiac disease is, it's basically a disease that involves the gut, where your gut is sensitive to gluten, which is a protein that is found in wheat, barley, and oats. So for some people, when they're reacting to this gluten, it affects them severely. And apparently there's a high correlation to celiac disease and cardiovascular disease. Socioeconomic disadvantages. So poverty is linked to your risk of heart disease. Low-income households tend to have a higher risk of heart disease. So it's interesting how developing nations apparently are at higher risk of having cardiovascular problems with their health. So it's something that we need to be aware of. Air pollution can also affect your cardiovascular health. There has been some evidence apparently that some particles of the air or some air pollutants can actually encourage the development of atherosclerotic plaques, which are these sediments that I was talking about in your arteries. A previous cardiovascular history, so if you've had a heart attack before, or if you've had stroke before, that increases your risk of having another heart attack or another stroke. So when you've had that before in the past, it means that you need to make sure that you are visiting your doctor, you're following what you're being told by your doctor, so that you at least keep that risk at a minimum. And then finally, we've got your mental health. There's a high correlation between depression, anxiety, and post-traumatic stress with cardiovascular disease. So you find people that are very nervous, people that are depressed, they are at high risk of developing cardiovascular disease of some sort. And then we've also got our genetics. I remember in medical school, our lecturer used to tell us that if you're Black, dark, and you're Afro-Caribbean, then your risk of heart disease is very high. So you need to be on the lookout and make sure that you know what to do and what the symptoms are. So there is a very high correlation to Afro-Caribbean people and diseases like cardiovascular disease, diabetes, and hypertension. For men who get cardiovascular disease under the age of 55 and women under the age of 65, then you need to look into their history. Usually, if you have a first generation relative, so your parents, if they've had cardiovascular disease before or in the past, then chances are you've got a threefold risk of actually developing it yourself. So those are the risk factors. In terms of symptoms, in terms of symptoms, so the most common symptom for cardiovascular disease when you're talking about the heart is chest pain. So people tend to come in and they complain of tightness in their chest. It feels like a band across their chest. Some people say that it feels like an elephant is actually sitting on their chest. It's a very sort of like a painful, heavy feeling, which tends to it radiates or it travels to either your jaws, or it can go down your left arm. Sometimes it can go down both arms. Some people feel weakness, numb legs or arms. You get breathless, especially for people that are having a heart attack. You can get breathless. Some people start sweating profusely. I've heard a couple of people describe it as, they get this sense of doom, like as if the world is ending for some reason, and they just can't breathe. They can see that something bad is happening. So that's some of the symptoms. For some people, you get a very fast heartbeat. For some, it's a very slow heartbeat. Palpitations, those are symptoms of cardiovascular disease. Feeling dizzy, lightheaded, or feeling faint. There are people that sometimes just have fainting fits. And fatigue, feeling tired. You know, just for no reason, you're feeling tired, you don't really know what's going on. And swollen limbs. So people who tend to have heart failure tend to start developing swollen legs. So they're basically their legs start swelling up. Some people come in with swollen ankles. You know, that can be related to your heart as well. So would you want me to talk about symptoms for stroke, or are we just talking about the heart?
Let's just do the heart now.
The heart, okay. All right.
Thank you very much.
Thank you.
Right. I can see some lovely comments coming here on Facebook. So far, people are loving it. They think it's very educative. So thank you, my panelists. Dr. Lai, how is cardiovascular diseases? How are they diagnosed?
So we could have a whole month session on that. However, you know, when we talk about cardiovascular disease, as Dr. Ado said initially, I mean, that's such a broad area because you have, you know, the cardiovascular system, like encompassing about 3 football fields, as he said, right? So there are several of them. I just want to just say something quick about what Dr. Anand was saying, and then I'll be very brief on this, because as we talk about the specific conditions, we'll talk about how they are diagnosed. So when we look at the risk factors for cardiovascular disease, as Dr. Anand elaborately said, okay, we can put them into 2 categories, right? One is a category where we can modify those risk factors. And then the other one, risk factors that we cannot modify. You cannot do anything about it, okay? So you cannot change your genetics, okay? If you're a man, you cannot change the fact that you're a man, okay? You cannot change your age. I mean, you can change it on paper, but in actual fact, you cannot change it. So you cannot modify your age, you cannot modify your gender, you cannot modify your genetics, okay? The other risk factors that she mentioned, you know, high blood pressure, diabetes, lack of exercise, obesity, smoking, excessive alcohol intake, poor dietary habits. These are modifiable risk factors. And I think as we go forward, you know, those will be the important things that we are going to emphasize, that it's important that the ones that we can modify, we need to work on those and make sure that we modify them. You know, if you have high blood pressure, to make sure that your blood pressure is under control. If you have diabetes, to make sure that your blood sugar is under control. If you don't have diabetes, you undertake habits that will not predispose you to getting diabetes, okay? So those are very important, and we will harp on the modifiable risk factors as we go along. Now, in terms of how they are diagnosed, you know, so it depends on the part of the body that's affected. So as Dr. Ado said, you have blood vessels that are going from the heart and supplying nutrition and oxygen primarily to every organ of the body, right? So if you have the blood supply being cut off or decreased, so as he used the analogy of the house and the pipes. So if your pipes are clogged, the amount of water that's coming out of your pipe when you turn on the tap is going to be dripping instead of a free flow. So depending on which organ has blocked arteries, then they are not going to get enough blood, enough oxygen. Then that organ is going to not function at its optimum level. So if it's affecting the heart itself, the heart, even though it's pumping blood to the rest of the body, it also needs blood. And so if the blood vessels that feed the heart are clogged, then it's going to affect the heart's ability to pump blood, right? And that's what we will talk about shortly about, the different conditions that can affect the heart. Same if the blood vessels to the brain are clogged and then you don't get enough blood supply to the brain, then you can get a stroke. And Dr. Akpalu will go into detail about that. Or sometimes you can have bleeding into the brain that can also cause stroke. So you can have it affecting the kidneys, you can have it affecting the intestines, you can have it affecting the limbs. So there are some people who have what we call peripheral artery disease or peripheral vascular disease. That means that the blood supply to their limbs is clogged, so they don't have enough. And when they walk or when they try to run, they will have pain in their calves. And sometimes they have to stop for several minutes before they can continue to walk again. And sometimes it can get to the point where the blood supply to the limb is completely compromised to the extent that they have to amputate the limb because the limb kind of goes dead. So in terms of how we diagnose it, we will talk about it as we talk about the different conditions that we are going to discuss. And then down the line, we will talk about some tests that we do to diagnose these conditions.
Lovely, thank you. Dr. Palu, so when Dr. Anand was talking, she made mention of a couple of things like abnormal heart rhythm, palpitation. What is palpitation, please? And when you finish, could you please explain to us what is abnormal heart rhythm?
Okay, I think I'll defer those to the cardiologist. Right. But basically, an abnormal heart rhythm, our heart should beat like a normal drum beat. If I can drum it for you, regularly about 60 to 99, 60 to 100 beats per minute. Now, you can have an irregular heart rhythm. It can beat very fast or beat very slow, and the beating fast could be in various dimensions. So for us, for me as a neurologist or for the cardiologist, for me, one of the most important abnormal heart rhythms we need to look out for is it's called atrial fibrillation. So your heart should be open pump, and pump all the blood out. If you start having your heart not beating effectively, the blood clots, and then the next good heartbeat, you throw all the clots up. So atrial fibrillation is an important heart rhythm which needs to be dealt with. I mean, there are lots of other rhythms. Some can be shocked, some cannot be shocked, some you can do nothing about, but they are there. So it's important to know what type of rhythm you have. There are lots of tests, electrophysiological tests to find out which heart rhythms they are, and there are various treatments for them. Some are very effective, some are not. But if you don't get your heart rhythm correctly, the most important thing you get is a stroke. And the cardiologists have a lot of nice terminologies to become our friends, like VASC and all that, to calculate scores of how easy it is for you to get a stroke if you don't correct those heart rhythms. Thank you very much.
So over to our cardiologist. Do you want to add anything, or should I just go on to the next question, which is heart work?
Right. So I can add on a little bit. So when people say palpitations, and actually this definition is very important because that is what would bring people to the doctor.
Right.
Normally, we should not feel a heartbeat. Nobody should. If you feel your heartbeat, it's called palpitations. And the simple thing you should do is to see the doctor. That is all you need to know. If you start feeling your heartbeat, either my heart is racing, is skipping, is going too slow, or I can feel a sensation in my chest, I can feel my heartbeat. See a doctor. Indeed, it could be nothing, but it could be something. Even your doctor at the time you see him may not be able to tell, primarily because these symptoms may just be intermittent. And so what intermittent is, every now and then you feel it, at times you don't feel it, and you're just feeling good in between. But when you see the doctor, what he's going to do is what we call an ECG or an EKG, which looks at the electrical conduction system of the heart. Okay, then he's going to do a cardiac ultrasound, otherwise called an echocardiogram, which looks at the heart muscle and its pumping function. And it also looks at all the blood, all the valves. So all the doors going through the house, your doctor is going to look at those. So if you have an abnormal heart rhythm in a good heart, your doctor is happy. If you have an abnormal rhythm or palpitations in a bad heart, your doctor is not happy. So the first thing he's going to do is good heart, bad heart. Now, like I mentioned, at times he doesn't know why your heart is skipping. So there's what we call a Holter monitor. It's painless. It's maybe slightly inconvenience, but all he's going to do is have you wear this monitor pretty much like you have a cell phone in your pocket every day. So you wear it from 24 hours to 30 days. And these days we could give you a monitor even up to a year or two. So whatever you are having, it can pick it up. Now, remember what we said, palpitations is awareness of your heartbeat. It could be something, it could be nothing. The person you want to leave it that decision to is your doctor. So you want to go in. Now, that awareness of the heartbeat, at times it's just maybe you got stressed out, you're worried about something, and your heart is beating very fast and you're aware of it. And if that indeed that's all is going on and you have a good heart, you're pretty much doing okay. It's just reassurance, you know? And if you work with your doctor, you'll be able to tell. But what you don't want to miss is there's something going on and you just wrote it off as nothing, you know? So I can tell you many stories about palpitations, but palpitations is simply put an awareness of your heartbeat. Maybe something, maybe nothing. Leave that to your doctor, see a doctor. Because indeed, if you don't, and there's something bad going on, that could be a problem. So like Dr. Palu said, one major cause of a stroke when it comes to an abnormal heart rhythm is what we call atrial fibrillation. And so the first time a person knows that they've got atrial fibrillation is when they come in with a stroke. So he comes in, he has a stroke, and you talk to him. Well, now he has an abnormal EKG, or on the monitor, we can see that he's got this atrial fibrillation. But if you talk to him, he's telling you for the past 2 years, my heart has been beating fast and irregular. I feel my heartbeat on and off for the past year or two, or for the past 6 months. And why didn't you do anything about it? Well, nothing, because it seems to come and go, and I'm fine in between, you know? So I realize the biggest thing you always want to tell patients and you want to tell the general population, when you start feeling your heartbeat, see a doctor. And that's all you need to do.
Right.
Okay, thank you.
Thank you. I think that's just a very simple message. When you begin to feel your heartbeat, see a doctor. And it's just that simple. He says, leave that with a doctor, whether you feeling your heartbeat means something or it means nothing. Leave that to Dr. Frank Addo and his colleagues to decide. But for starters, you just go in and see them. That's amazing. Thank you. Now, based on this explanation, could you just briefly explain to us how the heart works, Dr. Addo, once again?
So, you know, the heart is a pump. And so, you know, it pumps, its function is to pump blood around the body. But the most important thing is the blood contains oxygen. So the blood is carrying oxygen around the body to all your tissues, okay? So now the heart has a pacemaker, otherwise called a generator in your house. So you turn on the light in your own house. That is how the heart is. The heart also has a generator. There's electricity coming through the heart, and it's an inherent generator. We are all born with that electricity in our heart. It's called the SA node. It's a big word. Just know your heart has electricity. Born, everybody has it. Okay, so what happens then is you have electricity going through your heart, and that is what causes your heart to pump. So we've all seen diagrams of your heart squeezing and releasing, squeezing and releasing. It's that electricity that is causing it to do that. Now, the reason it has the need to do that is because there's blood coming through it. So pumping and relaxing, that is what will send blood from the heart to the rest of the body. So the blood goes to the body everywhere. Your tissues will utilize the oxygen in that blood. And then that blood that has no oxygen now will come back to the heart. So when it comes back to the heart, it goes to the lungs, and we all breathe when we are alive. So then you have oxygenation again. That blood gets oxygen again, and that oxygenated blood from the heart goes again to the rest of the body. So that is pretty much that circulation of blood going from your heart to the tissue, back to the heart, receiving oxygen through your lungs, and so on and so forth, on and on and on and on throughout the day. If that process should stop, we all know what happens. It means you are dead. Okay, so everything we're talking about here today is to ensure integrity of this circulatory system. How can we make sure that that electricity is going through, that the heart is pumping, and that you're exchanging oxygen at various tissues in your body? If for any reason you have problems along this chain, either in the heart or at your blood vessel level or at the tissue level, you end up with a disease process, which is cardiovascular disease, as we're going to discuss as we go on through this program today. Thank you.
Thank you very much. Does anyone want to add anything to what our cardiologist has said?
I think it's important for us to just mention some of the causes of palpitations so that we don't have people in a panic frenzy every time they feel their heartbeat and running off to the doctors. So palpitations, medication can cause palpitations. So when you get your medication from the doctor and you start feeling palpitations, check your medicines and see what the side effects are. And if you're still worried, like what Dr. Ado has said, go and see your doctor, don't sit on it. Hormonal changes. So women, when you go through menopause, you do get, as your hormone levels is coming down, you start getting things like palpitations. Those are some of the symptoms of menopause. So if you're an older woman and you're getting palpitations, go and see your doctor, but just don't panic about it. It could be just because your hormones are coming down. Anxiety, stress can cause palpitations. So, one of the things that I tend to tell patients is try and relax a bit and see what happens. Try and look around and see, is there anything stressing you out, or is there something that is making you feel uncomfortable? That could be the reason why you're having those palpitations. The other thing as well that can be a cause of palpitations, smoking, alcohol, the things that we've mentioned about cardiovascular disease, drugs, recreational drugs. People that use drugs, can also suffer from things like palpitations. So those are some of the things to be aware of when we're talking about, you feeling that thumping in your heart. But take-home message is go and see your doctor. Anything to do with your heart, if you're worried, go and see your doctor. Thank you.
Absolutely. Thank you.
Thank you.
The take-home message is to go and see your doctor. Talali, do you have anything to say with regards to that, or should we move on?
No, I think we should move on.
Good. So back to you, Dr. Ado. What is a heart attack then? I have heard so much about heart attacks. I'm sure to you, I don't want to ask, but yeah, what is a heart attack? And how could I explain that to my 12-year-old, to my 7-year-old, to my mom or my grandma who is 90 years? What is a heart attack?
Yeah, so at the beginning, we said the heart is a pump, and that this pump has muscle, and that this muscle itself also needs blood. So that is what we call the coronary arteries. So heart muscle itself has its own blood supply. And these are the coronary arteries that run on the surface of the heart. Now, Dr. Anand did say, since you were a teenager, so somewhere around age 17, we all start developing what they call fatty streaks. So you start developing plaque. So it's mild plaque, and as we all age, this plaque is just material that is sitting in those arteries. So with time, what then happens is based on our risk factors. So everything we're talking about here, risk factors, risk factors, risk factors. So how much plaque do I have as I grow up, as I age, depends on how many risk factors I have. Okay, the more risk factors I have, the increased chances that I have more plaque in my arteries. Okay, now what happens is you have fatty streaks, just mild plaque, and then you can have moderate plaque and you can have severe plaque, all depending on your risk factors and how old you are, etc. So what then happens is this plaque is sitting in your arteries. So think about your arteries like water hose. Most people know what a water hose is. We all have gardens, we use it, okay? Or your kitchen sink, okay? When you open your faucet, there's a connection that sends that water that you open out of the house. So what happens then is we've all had our kitchen sinks once upon a time blocked before, right? You open the tap and water does not go anywhere. So in some people, what will happen is with age and with multiple risk factors, we develop mild plaque disease, just like the kitchen sink that has been used over 20, 30 years. One day you wake up, you turn on that sink, water does not flow. One day you wake up, you start having chest pain, and you're wondering, what happened? Why am I having chest pain? Basically, what it is that plaque that you have sitting in that artery, a blood clot has formed on top of that plaque, okay? And then all of a sudden, it cuts off the blood supply to the heart. So all of a sudden, you open your tap, and now the tap does not run, okay? So basically what happens is you now have a blood clot sitting on top of that plaque disease, which has been there for several years, okay? So just like your kitchen sink that you've been using for 20 years, it did not block that day. You started blocking over 20 years where you have just little material sticking in there, sticking in there, sticking in there. And then one day you had a big cooking spree, whatever, you threw some things down the sink and boom, here you are. The sink doesn't flow anymore. It's the same for your heart, okay? And I use this analogy just to help patients understand that that blockage was not because of what you did yesterday. It's because of what's been going on for 20 years in your life. Fatty streaks since age 17. It's what now is showing up at age 57 as a heart attack. Okay, so what happens then is you have blood cutoff to your heart muscle because now the blood vessels are blocked. And that heart muscle is dying. It's in the process of dying. And when it dies, we call it a myocardial infarction. We call it a heart attack. And that's what a heart attack is. And the reason I don't just say a heart attack is, you have a big blockage sitting in your artery and that's it, you have a heart attack. You don't have a heart attack in a single day. You have heart attacks over a lifespan. In other words, it's a slow process that one day comes to hurt. Finally, it's going to hit you one day. Okay, so when Dr. Lai talked about modifiable risk factors. Dr. Anand talked about risk factors, okay? My exercise, my eating well, my treating blood pressure, my treating cholesterol, my decreasing weight. What is all this about? This is about making sure that over a period of 20, 30 years, I'm not slowly blocking that artery, that I'm not slowly blocking my kitchen sink. And that's pretty much what risk modification is all about. Okay, so when heart muscle is dead, why are we all so concerned about heart muscle is dead? The reason is cardiac muscle, for the most part, does not regenerate, just like in the brain. Okay, cerebral tissue, for the most part, does not regenerate very well. So if you have a heart attack and you lose muscle, if you have a stroke and you lose brain tissue, you've almost lost it for good. And it depends on how much did you lose. That is what is going to determine the consequences of that heart attack. Okay, so if you're lucky and you just lost a little bit of tissue, you get away with it. If you lost a lot, then obviously the consequences are going to be more grave or more serious. Okay, so heart attack, simply put, is dead heart muscle. Okay, but that doesn't help us. What helps us is understanding the process that actually, with a change in lifestyle, I can prevent, or I can reduce, or I can decrease the number of years that it takes me to get this heart attack just by modifiable risk factors. Okay, exercise, eating well, decrease stress, active lifestyle, treat blood pressure, treat cholesterol, do not smoke, treat diabetes, decrease alcohol intake. These are the things that are going to decrease my chances of having, a blocked artery. Thank you.
Thank you very much. And from the way you did explain, I think I can definitely explain to a 7-year-old what a heart attack is. So thank you. I like that analogy of the sink. And obviously, like Dr. Adu said, it didn't happen based on what you did yesterday. So if you just think, oh, you had a fatty piece of meat yesterday, that's not going to result in a heart attack necessarily tomorrow.
Thank you.
It's over a period of time. Thank you very much. And Dr. Patience Anand, what are the symptoms of a heart attack? Could you briefly walk us through some symptoms?
Yeah, sure. So the first thing I would like to stress is that a heart attack is an emergency. So it's something that when you see it, you have to act quickly. That's not the time to pray or, do some libations or, call the ambulance and get to the hospital as quickly as possible. So I did touch a little bit on some of the symptoms. So the first symptom is, the most common symptom, some people don't have that, is chest pain. So severe chest pain, tightness. You feel like you've got a tight band around your chest or a heaviness around your chest. Some people start sweating. Some people become very anxious. You get a very fast heart rate. So you get an arrhythmia, a fast heart rate, which you can feel. The pain can go up your jaw, can come down your left arm. Sometimes it can go down both arms. It can go to your back. For some people, it can feel like indigestion, especially for women. That's their common presentation. They feel like they've got a bit of heartburn, and their food is not sitting properly, and not knowing that they're actually having a heart attack. I recently had a family friend who woke up early hours of the morning, a man in his early 50s, thought he had really bad indigestion, woke his daughter up and said, I just don't feel right. Can you get me some Gaviscon? The daughter went, got him some Gaviscon. Pain was not settling, still feeling like he's got really bad indigestion. And fortunately enough, his daughter is a nurse who's just qualified. So she started, asking questions and quickly called the ambulance. And lo and behold, he did actually have a heart attack. So that is how, serious this condition can be. You can also have shortness of breath. So when you start feeling like, you can't catch your breath and you're not doing anything, you're not exerting, you're not jogging, you're not running, that's one of the symptoms of a heart attack. Feeling weak, lightheaded, or having both of it. And also the feeling of impending doom. So a lot of people, I don't know, is that right, Dr. Ado? A lot of people say that they feel like the world is ending, like there's a darkness that just kind of comes over them and they know that something is not right. For Caucasians, they get really pale, like almost, become like gray in color. And when they come in, if you touch their skin, it becomes really clammy. So it's kind of sticky. And you know that something is wrong, something is not right. So those are the symptoms for a heart attack.
So let me say something here in addition to what they have said. So sometimes kind of a condition that is leading on to a heart attack is something that we call angina or angina, right? Where people will have pain or the chest pain with exertion. Okay, they do something small, they will have chest pain, they have to stop. Analogous to what I mentioned earlier on about, say, having plaque in the legs, in the arteries of the limbs, and sometimes some people, they walk for short distances or for certain distances, and then they have to stop because of pain. So what happens is, as you exert yourself, the body has to increase blood supply, okay, to various parts of the body to meet the demand of kind of the exertion that you are doing. So as you try to exert yourself, the heart also needs to pump more. And so if you have the plaque sitting in there, it may not be completely blocked, but it's blocked partially. Then the amount of blood that needs to be increased to the heart muscle for it to pump well is not getting there. And so then you start having those. So sometimes that may be a precursor of a heart attack that is about to happen. Okay, and there are various degrees of it. Sometimes we say stable angina or unstable angina. That means they are really at the point where they are going to have a heart attack. So I think we will address it later on, but I just wanted to bring that also into the picture that sometimes people may, they do something little, they feel chest pain, and then when they are not exerting themselves, they are fine. And so they may think they are okay. And this is also something that needs to be taken to the doctor. And I think Dr. Ado will probably address that in detail a little bit.
Awesome.
Yeah, thank you.
Awesome. Thank you very much. Dr. Palu, are you there?
Yes, I am.
Now I've got a question for you. Now I know a lot more about heart attack now. Could you shed a bit more light on stroke? What is stroke? And how do we recognize stroke?
Stroke, okay. So I think the definition of stroke has changed over the years. And the cardiologists always like the limelight. We are used to that, but we move from heart attack to heart attack to have a brain attack. Okay, so our adage is time is brain, the same as time is heart. Time is brain. So basically what a stroke is, if you allow me to share just a few slides.
Right.
So just a few slides of what we mean by, all right, so a stroke is a sudden onset of either a focal or a global neurological deficit. So if you look at a brain, this is a pathological section of the brain. The brain has different parts. And as Dr. Ado and Dr. Anand showed you, it has a very vascular, it's very vascular. It has a very intricate blood supply, which can be blocked at each point. But basically what a stroke is, if in any part of your brain, there's a blockage of flow of blood, or there's a burst of your blood vessel, you can get you can get anything happening to you. You can lose your vision, lose your sense of balance, lose your sense of smell, stop talking, lose your balance, lose control of your hand, or you're talking right now and I stop talking, lose use of your hand, use of your leg, or you just go unconscious, go into coma totally, or it comes in little starting stages. So these are scary pictures. The first one is an image of a blood clot in the brain. So think of a hemorrhage into the brain. Think of your brain as a soft mushy organ surrounded by a hard case, and you get this big clot of blood in, and a clot of blood expands. So you can imagine the trouble you can have, as opposed to and in fact, when there's a clot of blood and no blood goes. So that is what we understand by stroke. But note that the old definition was that yes, you have to wait for 24 hours, and that's where we got left behind in the emergency rooms. Stroke used to be the last patients seen. The visitors come, they are lying down, and in our parts of the world, when you come to visit in hospital, the best food they bring is fried rice. So the patient is lying down flat, fed with fried rice. So by the time the relatives leave, patient is dead because he's aspirated. So our definitions have changed. We've taken over from the cardiologist. Time is brain. So when any of these symptoms are happening to you, you need to get to hospital. And as they've spoken a lot about the risk factors, so I'm not going to bore you with them. But what I want us to note that in the concept of stroke, there's a lot of interplay of genes and the environment. Genes and the environment. Genes, the environment, and ourselves. So what are we doing wrong? Our climate is changing. We have a lot of infections. COVID is causing havoc with stroke. There's a lot of stress. People don't relax anymore. We are it's even more stressful now with Zoom and everything than anything else. We are using GMO foods, pesticides. People are smoking more. There's pollution, noise pollution. I was amazed that looking at a big cohort of our studies for stroke, noise pollution has been found to be a risk factor for stroke. Environmental pollution, dust pollution, air pollution has been found to be risk factors for stroke. So we are changing the dynamics, because if you look at it, people are hypertensive, they are diabetic, they are supposedly well controlled. They control their cholesterol, they are walking, they are going to the gym, they have only one wife and nobody else, and they are doing what they are supposed to do, and they still come down with a stroke. These are some of the things that we need to look at. There are lots of metals and plastics. People try to analyze the fish we are eating now, and they're amazed at the amount of plastics and things in them. So these things are causing havoc. So yes, we are looking at the traditional risk factors. We've talked about them. We are controlling them, but there are lots of other new environmental risk factors which we need to deal with. So our socioeconomic, Patricia, Dr. Anand spoke about it, socioeconomic. Do poor people have more stroke than rich people? Well, the balance is there. What are our cultural factors? What cultural factors exist that predispose us to stroke? And I've talked about the environmental conditions as well. So what is worrying to us now, is that we are getting a lot of strokes in the reproductive age group, 16 to, let me extend it to 50-year-olds. Now, last year at the World Stroke Day, how many adults are here? How many people do we have online streaming? 1 in 4 of us are going to have a stroke in our lifetime.
Wow.
So let me repeat, 1 in 4. So the theme last year is do not be the one. So do not be counted among the 4. So unfortunately, it's myself, Maud, Jonathan, and Nanado who are on the screen now. So 1 in 4 of us may get a stroke within our lifetime. What do we do to prevent this? What do we do to stop it? So that is, I think, the focus of our education here. So as more than Jonathan and Nana, the family history of cardiovascular disease is key. Unfortunately, if you have a family history of stroke, your risk is up to 30%. So you cannot do anything. You can do something about that. So start making your family healthy, your extended family healthy, to stop you getting to that 30%. Now, the thing about stroke is that in our part of the world, there's a high mortality. It's coming down all over the world, but the mortality means that when I get a stroke, my risk of dying depends on where you are in the world, between 10 to 70%. So those who have a stroke now will lose their lives, they'll die. Now, those who are left, another 50% will have another stroke within a year. And the list, the complications, the list keeps going on. So the best thing is to prevent it and to stop it from happening. But those who are left have a very severe disability. You are a right-handed male, you are the breadwinner of your family, looking after yourself, your extended family, paying people's fees, and all of a sudden you have a stroke. What's going to happen to you? You're going to lose that ability to do anything. So that's enormous economic, mental, physical, and social burden. We have to address that we have to address that as well. So I've spoken about these factors, and if you get a stroke, you end up somewhere like this. Depends on where you are in the world. If you catch you within 3 hours. Now, we are watching in different parts of the world. Now, within 3 hours means that we need to have very good pre-hospital awareness. How many people are aware that the symptoms they're having is a stroke and can get to a unit where they can get a head scan within 3 hours, see a neurologist within 3 hours, be sent to a stroke unit and have your clots taken out or busted within 6 hours. We do not, many countries in lower middle income, I don't like those terminologies, but lower middle income and middle income countries, most of us do not meet that criteria of having your clot busted. But we can do some neuroprotective measures and get you home well enough to go back to your normal activity. So there are a lot of things that we need to know. If you don't take anything from this presentation at all, say fast. I think everybody say fast, F-A-A-C, act fast. You see somebody having facial weakness. There are other causes of facial weakness, but common one, your face is being twisted to the side. Most people say you're slapped by a ghost. You've been slapped by a ghost in the morning. And from where we come, those things are very real. So don't take this for granted. So usually a part of our health-seeking behavior, instead of finding out what caused the condition, we are looking for who caused that. So I mean, that is important too as well. But let us note what caused it. So your arm is weak, your arm is drooped, your speech starts getting slurry, and it's time to get into hospital. So the question is, where are you going to go? Where are you going to go to? So yes, you've had a stroke. What can we do? Most of the time, the injury has occurred already. What we are doing is called secondary prevention. So note very simple things, A, B, C, D, E. Okay, A is to get rid of the clots. We use antiplatelets like aspirin. Know that you need to get a head scan before you start chewing aspirin. As opposed in a heart attack, if you have chest pain, yes, you can chew aspirin. But if you're having a stroke, wait till you get a head scan done. Blood pressure control. So how many of you have had their blood pressures checked in the last 3 months and have their numbers, that their numbers are below 140 over 90? So the other campaign message is know your numbers, know your blood pressure, know your blood sugar, know your cholesterol levels, know what your uric acid is, and know your weight or your BMI. So you should know your numbers. What is your blood pressure control? So I think today, if you don't get anything at all from this, text your friend. If you say, good morning, what was your blood pressure today? What's your blood pressure good? Have you checked your blood pressure? I think this should be a Christmas present for everyone. Cholesterol lowering, starting, stop smoking. Okay, smoking is a big problem. If you have a family history of stroke, you're hypertensive, you're diabetic, and you're and you're smoking, that's big trouble. You're cooking for yourself. Diet is important. So those of us in our part of the world, we enjoy this food. I know Dr. Ado and Dr. Lai are salivating at what we are.
And so am I.
What is here is our diet is salty, but you can desalinize Kobe. It's a crime, but you can do that. You can desalinize that. Diet and exercise. We've all talked about exercise, walking, and getting fit. So as I said earlier, what we need pre-hospital awareness. You cannot have a good running stroke system without awareness of stroke. We need good support groups for our stroke patients. We need dedicated stroke units. We are doing that across sub-Saharan Africa now. And compared to elsewhere in the world, post-stroke, you need somewhere to stay to rehabilitate yourself before you go back to your community. And we need a concept called multidisciplinary teams. We'll talk about that later. But it's not only doctors who take care of strokes. We have stroke nurses, we have physiotherapists, we have occupational therapists, we have speech and language therapists, we have dietitians, we have psychologists, we have radiologists, we have social workers, we have priests, the cleaners. Everybody is involved in managing patients with stroke. So for me, this is key. And before the cardiologists come over, I think the challenge for us is to develop, wherever you are in the world, to develop your own locally acceptable prevention and treatment strategies based on good evidence that we have. While we acknowledge that there are limited available resources, everywhere else is going to get vaccine. We are going to wait for some time, but I think we are doing fine here. But we need to limit the future burden of stroke in sub-Saharan Africa and anywhere in the world. But the key is to develop locally acceptable preventive and treatment strategies. So I think I'll stop sharing here and then we'll continue the conversation.
Amazing. Thank you so much. I can see you've posted something on Facebook for us. Could you briefly talk us through, Dr. Akpalu, with regards to the Fight Stroke SASNet Ghana?
Oh, okay. So that's Adam. So we have an African Stroke organization, which is an offshoot, which is a member of the World Stroke Organization, which is there to develop locally acceptable programs to fight stroke. And one of the initiatives from SASNet is the Stroke Association Network of Ghana, is to help survivors with stroke and to improve awareness and education. And hypertension is the commonest risk factor for stroke, for heart diseases as well. So we need to get this down. We need to get this movement going to bring education across networks. So anybody listening to this presentation today, you can add on your CV, you are a strokeologist. Yeah, a cardiologist, but I can sign that certificate.
Strokeologist.
Yeah, strokeologist. So
I like that.
About stroke, yeah.
I like that.
Thank you, Dr. Akpalu.
Okay, thank you, Dr. Adams is the secretary of the SASNet. So he's a very active guy, and he's the secretary of the African Stroke Organization as well.
I would like to say a thank you to Dr. Palu for all the work that he's doing in Korle Bu and across Africa.
Yes.
Thank you, Dr. Akpalu. Thank you so much.
Thank you so much.
Thank you.
Yeah. Wow. I'm just trying to get some questions from the public and we'll move on. Could you just start tackling our myth? Some of the myths. So Dr. Akpalu, like you're talking about, someone wakes up with a droopy face and they think, I've been slapped by a ghost.
Ghost, yeah.
It's not a spiritual disease then.
Yeah. So health health is not the absence of, so there's physical, mental, spiritual, emotional well-being. So we need to take into all consideration. So as I tell people, one of the reasons of our high mortality of stroke in Africa is the health-seeking behavior of or the health-seeking behavior. I will not say of Africans, but across the world, everybody has a different health-seeking behavior. But ours is to sometimes to find who caused the stroke, not what caused the stroke. So we advise that as you are going to hospital, you be praying, doing everything that you want to do, but get to hospital on time. Time is brain. If you spend 2 weeks at a church camp with no results, and after the end of the 2 weeks you are spastic and you can't talk, and you come to us in our teaching hospital, and something happens to you, don't call us the last stop. You did not get there on time, and also the dynamics of health are different. We have to talk about health economics. Okay, yes, health insurance does cover some aspects, does not pay for a CT scan. Whereas in Dr. Laye and Dr. Ado and patients' strongholds, health insurance will cover for a scan. So it makes treatment difficult across the divide. So one of the campaigns we are seeking in your various countries is to insist on a CT scan in a region. I made a campaign of 1 CT scan per region. We have 16 regions in Ghana, and a CT scan is not expensive. So nothing stops us from having a CT scan in every region. Same in Nigeria, same in Dakar, same in anywhere. There must be enough CT scans to make the diagnosis, because without a CT scan, you cannot give aspirin, you cannot know what the next step you are going to do. So I think that there are various myths out there. And I'll talk about medication. We are men. There are men here. People think that people stop taking their blood pressure medications. Why? If you take a survey of both men and women, why they stop taking their blood pressure medication. Number 1, it affected my sexual performance. Number 2, it didn't make me perform. Number 3, I can't perform. Number 4, I'm not a man. Number 5, I've lost all my feelings. So yes, some of the older blood pressure medications cause that, but note that this is a holistic thing. If you are working 3 jobs and you have 3 wives and some other things, and you come home to someone, there's no energy left for you. So do not blame the blood pressure medication. I know patients will argue with me on that, but I think that's one of the myths that we need to do. So don't blame your blood pressure medications. Life is a holistic process. You have to be mentally, emotionally, and financially prepared to go anywhere. So that is all part of demystifying that here. So I think I'll stop here for our cardiologists to continue with some of the myths.
Thank you. Go on, Dr. Laye.
So yeah, I just wanted to just say a little bit. Maybe I'm not sure if people understood what Dr. Akpalu was saying about a scan. That when somebody is having a stroke, as he said, time is brain, right? And as he explained, there are 2 types of stroke. Either there's a blood clot, which is causing the brain tissue to die. Okay, the brain is not getting the oxygen that it needs, and so the tissue is dying. And he showed pictures of that. Or there's a blood vessel that has ruptured, that's bleeding into the brain. Now, the way you treat each one is opposite. Okay, if someone has a blood vessel that has burst in the brain, and then you go and give them blood thinners or a clot busting drug, it's going to make the bleeding worse, right? If somebody has a clot that is causing the brain tissue to die, then what you need to do is to bust that clot, dissolve that clot with something that dissolves clot. So the treatment for that will make a bleeding worse. So that is why he's saying a CT scan, a scan of the brain is very important, because that directs how you're going to treat the stroke. And so when he's talking about a campaign to make sure that there's a CT scanner in every region of the country, for those of you who are listening who may have some sort of influence, this is very important, to make sure that not only in the capital cities or in the big cities do they have these facilities, but in the other regions of the country that they can have these facilities, because if somebody comes in with a stroke and you can get a CT scan quickly, you can hopefully be able to target the cause and treat it so that they can regain function, rather than what he was saying, where people go and spend 2 weeks at a prayer camp and then the damage is already permanent before they come in. So I think that's a very important thing for us to understand.
Thank you. Dr. Ado, so is erectile dysfunction a sign or a symptom, or does it show any association with heart attack and heart disease?
So this is a story of erectile dysfunction and heart disease. Basically, if you remember at the beginning of this session, we talked about the fact that the heart is connected to a series of tubes, and that tubes go essentially to every organ. And that organ includes the penis. So you have blood going through your aorta all the way down, and it goes into your pelvis, and also essentially into the penis. So what happens is somebody may have peripheral vascular disease, which is pretty much having a blocked artery in the arteries that go to the penis. So in the big arteries that supply the penis, you may have blockages in there, okay? Again, it comes to the same risk factors, okay? And the biggest risk factor for that tends to be smoking, okay? So when that happens, you have decreased blood supply to your penis, and then you can have erectile dysfunction, okay? So indeed, cardiovascular disease could manifest itself as erectile dysfunction. Now, remember at the beginning we said, wherever blood goes, so can you have disease. And it's part of the cardiovascular system. So indeed, the cardiovascular system is huge, and there's opportunity for disease everywhere there's tissue, everywhere you see that you are living. All your organs, your skin, your eyes, there's opportunity for disease everywhere. And this includes erectile dysfunction, okay? So basically what we do is we ask a couple of questions, okay? Do you have any weakness in your legs when you walk? Do you have tightness in your calf muscles? When you sleep at night, do you have pain in your legs? Do your legs feel heavy? On and on and on. That's a simple test. And that test we use to find out if a person has blood flow into their legs. It's very simple, and you can even do it in your office, okay? Just by using a blood pressure monitor, you can determine if somebody has enough blood supply going to their legs, okay? So indeed, cardiovascular disease can present itself as erectile dysfunction. That's number one. Number two is the anxiety and depression that is associated with cardiovascular disease. So it is not uncommon to have a patient come in with, a heart attack or a stroke or heart failure, and then they get very depressed, because don't forget, most people are on maybe just 0 or 1 medication. And then what happens is they have a big stroke, they have a big heart attack. All of a sudden, we have them on 5, 6 medicines, okay, which they may need in the short term. Hopefully, in the future, medications come down, the burden of medications, okay? So they become depressed. They are not sure of themselves. What's going to happen in future? What is my outlook in life? How can I take care of my family? And Dr. Akpalu alluded to some of those. So education, once you start educating the patients and saying, this is not a death sentence, okay? We can treat this. You can go back to work. You are going to have a normal lifestyle. That decreases that anxiety and stress associated with heart disease. And indeed, that erectile dysfunction can go away. The other thing is also indeed some of the medications. But again, this is not the commonest thing why you're having your erectile dysfunction. Some of the medicines can, but this is where it comes to communicating with your doctor about it. It's a very difficult thing. I have a habit of asking directly to the patient, okay? And you'll be surprised. Some patients are very comfortable. Some patients are not. Some patients is the wife who talks about it, okay? And then it comes up for discussion, okay? Because again, it's a little bit of a stigma or myth. I'm a guy, I can't function. You know, I'm not able to partake in sexual activity with my wife. And that brings that stigma, and anxiety causes more anxiety, okay? So once you look at the patient's medications, you'll be able to drill down, okay, let's stop this, let's take this out, let's try this, that kind of stuff. You're able to get to the bottom of it, okay? So that is the story of erectile dysfunction. It should be discussed, it should be taken care of, it can be treated.
Yeah.
And the only thing that stands between the patient and treatment, it's not discussing it. Okay, at least in my practice, the people who have erectile dysfunction, if it's cardiovascular, it's taken care of. If it's not, I send you on to the urologist and they take care of it for you. Okay, these days, there's a lot a person can do in terms of treating erectile dysfunction, and to the point where nobody should be at home just depressed about erectile dysfunction.
So I think in another sphere related to that, we've seen a lot of rise in aphrodisiacs and all sorts of concoctions and drinks, which actually lead to an increase in stroke. So in trying to solve, in fact, those who take that do not need to take that. So that's, let me make a point of correction. A lot of people who are taking this performance enhancing concoctions, there's a whole list, and all old wives' tales, they don't work, but they rather increase stress and we see quite a lot of them at 2, 3 a.m. and there's trouble. So please, let's stay off those and know what our limits are, and let's do things within reason. I just missed something a bit. There's a study which has been done between Ghana and Nigeria looking at our stroke patients, and we found out that green leafy vegetables reduces your risk of getting stroke. So across the 2 big countries, we have lots of green leafy vegetables, and whatever soup in Nigeria is the same as stew in Ghana.
In Ghana.
Compared to efoiro, kontomire, cassava leaf, bitter leaf, all those leaves actually reduce our risk for stroke. So I think it was published in the Lancet last year, so you can look out for it. So green leafy vegetables reduces risk for stroke. We are trying to quantify which type and the quantity, but it's found to incontrovertibly reduce risk factors for stroke. So let's look at that. Let's look at something indigenous. So that's what I was looking at, talking about local preventive strategies. So if you go globally, a lot of people do not stroke much, do not smoke much in this part of the world. So we do, and if they do, they are smoking something stronger. So we'll talk about we'll talk about that. There's a big myth that marijuana reduce stroke or increase stroke risk. So that's a big topic. I know it causes heart attack, but as for stroke, we are still looking into whether some of our local, we are trying to work with our indigenous practitioners. Indigenous practitioners, I'll say our herbalists and other practitioners, they are part of our workforce. So whether we like it or not, we have to work with them. And we have, I have quite a number of them that we collaborate with. And in epilepsy, which is something else that I do, I have two people in the central region who send patients to me. So they tell them that this one I can manage, but this one has to come to the Dr. Palu. So I remember I was in clinic once, and they brought me a basket with 2 chickens and some fowl, and that the man has asked them to come to me because I'm higher than them. I said, no. That's not what it is. So I think we need to have our collaboration with them. They are there, they are in their community, they are there more than us. They have a way of having a hold on our patients. I think we need to learn something from our traditional medicine practitioners. Because if you're coming to my office, Mod, you wear your shoes and you walk in, and I have to open the door for you and exercise. But if you're going to a traditional medicine practitioner, you have to take off your shoes, you have to walk backwards or walk, and that gives an air of invincibility. There's some myth, there's some aura. So if he says, not eat chicken head or chicken leg, you obey that traditional health practitioner. But if I come in, I'm wearing a white coat, and you have to pay to see me, and I say, don't eat chicken head, and when you get out, they say, this guy is out of his mind. I'm going to eat, you even eat double portion. Learn something from these practitioners. Okay.
Lovely, thank you. Dr. Annan, I was just wondering, in the southern of Africa, do you know of any of these green leafy vegetables that you could also recommend?
So, I mean, it's quite an interesting research, or that Dr. Albert is talking about. I didn't know about that, but we do eat a lot of green leafy vegetables. I'm not sure whether it's the same as in West Africa. We have our own local names for it, but I think here it's called kale, something like kale. Yeah. So that's what we normally eat, and we eat a lot of that with our meat sauces and things like that. So it's quite interesting that if there's evidence that it actually reduces the risk of stroke. That's very interesting information.
Yeah, so I think, regardless of where you are, okay, especially those in Africa, I mean, our local traditional foods, tend to be healthy. Unfortunately, as people kind of get into the middle class, okay, as people get more affluent, then they think that they need to eat like the white man.
Right.
They need to eat
GM foods.
Yes, and then people are they give sausage as snacks for their children. Those are not healthy foods. I mean, our local indigenous foods are the healthy foods, and Dr. Akpalu showed some pictures of that, and he was teasing us that we were salivating. We have fruit, we have vegetables. Those are more healthy compared to the steak, the burgers, fried chicken, the foreign foods that are coming that people think, oh, now I'm wealthy, so I go and eat at some restaurant, or I go and eat, burgers, and stuff. I'm telling you, those are not healthy for you. The ones that are healthy for you are your local foods, some of which Dr. Akpalu is showing here, which is, typically.
Is that a pumpkin? Is that pumpkin leaf? That looks like pumpkin leaf.
This is contumely.
Okay.
Yeah.
We
You
have
pay a fine. Patricia, I'll fine you.
So this is spinach.
Is it spinach?
With avocado pear and green plantain.
Plantain, okay, and fish.
This is called Kobe, which is desalinated Kobe, which is
right.
done, but it's not fair. Yes.
Okay. we eat a leaf like that. It's pumpkin leaf, and it looks like that. Yeah.
Like that. Okay. This is ground not by a machine. It's ground in an earthenware pot.
Right.
So, yes, you have the taste in. Yes.
I think Albert really likes this. He had to. He had to emphasize that. It's an earthenware pot.
Right, Doctor, I have a question for you. It says, what's the role of sleep and happiness in the heart health? What is the role of sleep and happiness in heart health?
Oh, okay. So basically, in the past several years, there's been a big focus on sleep. And I can just tell you a story from last night from, one of my patients. We know what we call sleep apnea, or if for any reason somebody is not sleeping well. Okay, so if you're not sleeping well, your body does okay with spontaneous, or even if you could say high burst of stress. So if I'm chased by a lion, that's okay. That kind of stress is fine. If I got frightened and I had to run away, okay, so traditional fear flight response, okay, is actually okay. It's built in there for us to be able to get away from danger, okay? Now, what is the problem with stress? The problem with chronic stress is having been chased by a lion every day for several months. That is not a good thing. That's the analogy I give my patients. So people say, oh yeah, but we need stress to be able to write that exam, to be able to run around, to be able to do this and that. Yes, that is high volume, high amount of stress for a short duration. You don't want to feel like you are being chased by a lion for 3 months, 6 months, 1 year, 5 years. What you're having is basically you're having increased adrenaline, increased corticosteroids, you're having increased growth hormone around your body all the time. That leads to tissue degeneration, that leads to increased blood pressure, that leads to increased stroke, that leads to increased heart attacks. So when somebody does not sleep, basically what happens is their body is heightened, there's increased stress, which leads to increased stress hormone production, which are the adrenaline, growth hormone, and the steroids, corticosteroids, that glucocorticoids that your body will produce. Okay, so that is not good for the body. That is why we emphasize sleep, that people should be able to sleep. Because when you sleep, indeed, your parasympathetic tone, which is your body state that sends your body to rest. At some point when you're being chased by that lion, you need to be able to exit that chase. You need to get into a house, a safe place. When you sleep, you are in a safe place. And you have your parasympathetic nerves take over. Some people don't have that luxury, and they are being chased by a lion consistently. Okay, so that is why you hear, oh, somebody had a heart attack in the early hours of the morning, somebody had a stroke in the early hours of the morning. This is pretty much what's going on. So people may wake up with persistent high blood pressure. When we sleep, our blood pressures are supposed to go down. Your pulse is supposed to go down. And it's interesting if you work in a cardiovascular unit where at night, a nurse will call you and say, oh, this patient's pulse is 60 or is 50 because they are on a monitor. And I tell them, it's normal. They are sleeping. It's healthy. That's how it's supposed to be. Do not panic. The people I'm concerned about is the guy or lady who is asleep and the pulse is 90. Why is your pulse 90 when you are asleep? It means you are being chased by a lion. So that person actually does poorly. Okay, so that is the whole thing about sleep. Now, recently, everybody has heard about sleep apnea. Basically, a condition where when people may, and most of it, there are two types, central and obstructive. But most of what we see is what we call obstructive sleep apnea, where people go to sleep, then, they start snoring. And when they snore, there's they'll pretty much stop breathing, primarily because your body produces increased carbon dioxide, okay? So your oxygenation is cut off. and you have increased CO2. Once you have hypoxia and you start becoming hypercapnic, then you wake up. But when you wake up, you do not know that you actually are doing this overnight. All you know is, oh, everybody says I snore. But the importance of that is every night when you sleep, you wake up several times over the night, and you've not actually gone to bed. But it's not part of your awareness. So nobody comes and says, I'm awake several times at night. What happens is your doctor may suspect it, primarily because your blood pressure may have become very difficult to treat, or you presented there with just being tired all the time, okay? And so the way it's going to present is, I snore at night. My wife says I stop breathing, and at times she gets scared and she has to push me or hit me to turn or to stop snoring, and she's concerned that I'm not going to breathe again. I wake up, I have a headache. I'm tired all the time during the day. I tend to fall asleep when I'm not physically engaged during the day. So if you come to the waiting room, the guy is sitting down, he sat down for 5 minutes waiting for the doctor, and he's already asleep, okay? And they come in and they have high blood pressure that is becoming difficult to treat, okay? We know that there's an association between increased cardiovascular disease and sleep apnea. Indeed, when you treat the sleep apnea, the burden of cardiovascular disease seems to go down, okay? People have less arrhythmias, less palpitations, less atrial fibrillation, decreased blood pressure, okay? And certainly increased well-being, all right? So what happened yesterday was I had a text from a patient who also happens to be my friend. I haven't seen him in 8 months. The last time we met, he was referred back primarily because his blood pressure has become uncontrolled. He's on 2 medicines, but when he saw me, he was on 4. And indeed, we had to increase the blood pressure medications because his blood pressure was really high. So we got to talking, and I asked his wife, does he snore? He said, well, not a whole lot, but the guy told me about being tired a lot during the day. Now, one thing that is actually very sensitive and specific for making that diagnosis is, how many times do you go to the bathroom to pass urine? I know a lot of men may have prostate disease and they may wake up to go to the bathroom maybe 2 times. But when somebody is going to the bathroom 4 times and more, there's a reason. When they go to bed, their body secretes a certain hormone, okay? And it forces them to pee, so they are diuresing. And indeed, what he said was, yeah, I wake up 4 times to go to the bathroom. And we said, well, more than likely you have sleep apnea. Go and do a sleep study. He did not for 2 months because he was just being stubborn about it. He finally did because he had no options. He said, I felt so tired, I didn't know what to do. So he did it. He got his sleep up. I haven't seen him in 8 months. He sent me a text just to do what? Hey, Frank, thank you. I'm like, for what? He said, well, remember that CPAP? Man, I'm a new man. And that was incredible. Sleep apnea can be a cause of misery for patients, and they may present to you as cardiovascular disease. Okay, having said that, sleep can be a little bit very tricky. There are some patients who just have different sleep patterns. They are not tired, etc., etc. You know, so you just need to tease out what is sleep apnea and what is not sleep apnea. And by the way, this gentleman, he's off the extra 2 medications. His doctor took him off because when he got the CPAP, when that sleep apnea got treated, it went away. His blood pressure came down. So indeed, sleep apnea can be it can be a risk factor for cardiovascular disease. There's an association between sleep apnea and cardiovascular disease. Is, you know, these days, and stroke. So these days we are talking a little bit more about it. And even, you know, It wasn't common around the United States even to have these studies, but these days it's becoming common. I know even in Ghana right now, we do sleep studies and stuff,
yeah.
which is actually a very good thing. People are on CPAPs and stuff like that. So sleep apnea is a disease that should be taken seriously. And indeed, patient sleep is very important. You do not want to be chased by a lion every day. And that is what we call chronic stress. So that's what I want people to understand. Chronic stress is equivalent to being chased by a lion all the time.
Awesome.
I have a better analogy. Being chased like by your landlord who owes you rent for 3. That's better.
Oh my goodness.
And that's exactly what it is.
That's amazing. Thank you so much. So all too soon, our time is up. Dr. Anand, what would you like us to take home? What would be your take-home message for us tonight?
So heart attack is an emergency. As soon as you notice the symptoms or you can see someone has got the symptoms, call 999 or whatever emergency number you have in your region. And like what Dr. Albert said, FAST. Remember that acronym, very important for stroke. If you notice those symptoms, call again the emergency services and get to the hospital as quickly as possible. That's my take-home message.
Right, amazing, thank you. Dr. Lai?
So I think one of the biggest take-homes for this time is, to understand the risk factors for heart disease and stroke, as we've talked about, and we've talked about there are some risk factors you cannot modify, but the ones that we can modify, we've talked about, making sure that high blood pressure is treated, diabetes is treated, having adequate exercise, weight control, making sure that we are working on, decreasing weight, and all the other, diet. We've talked about diet a little bit. All those things are risk factors. And then also the symptoms that we've talked about, which, are signs of, heart disease or stroke, that time is of the essence. And when you are having these symptoms, you need to get to the hospital right away. So that will be my kind of take-home message.
Amazing, thank you. Actually, that was what I got. That got to me the most. That look, there are some things you cannot change. I cannot change my genes, but there are some things I'm definitely in control and I can change. And as a mother, this is what I need to teach my children. This is the sort of lifestyle change I would like to effect in my home, making sure we are eating the right things and not thinking that actually sausages, fries, burgers, because you think you are doing well. No, but actually go back to the roots, leafy vegetables, eating the right things, limiting the amount of salt and oil intake. So thank you. Yeah, Dr. Frank.
Actually, can I just say, processed meats, I think, especially here in the West, those tend to be the snacks that children are given, sandwiches, all the hams, and they also have a lot of salt in them and are very unhealthy. And those are the things that most children are fed, So it's a take-home message that, we need to start thinking about the kind of things we're putting in our children's lunch boxes when they're going to school.
Awesome. Dr. Frank Ado.
Yeah, so this is my take. We talked about risk factors, modifiable, non-modifiable. It's very important. And when I talk to my patients, this is what I tell them. Risk modification is like the kitchen strainer.
Right.
Okay. In your kitchen sink. If you look, most houses, kitchen sink has a kitchen strainer. That is risk modification. Yeah. And those are all the things that we've talked about. You do not put things down the kitchen sink. All right. So don't throw down things that will cause blood pressure. Treat your blood pressure, the cholesterol, etc., etc. The lifestyle changes. These things are hard to do. So this is what we know. If you start changing lifestyle. It will take you 1 to 2 years to change a lifestyle. So the number one thing that people get discouraged about is, oh, I've been trying to exercise, I've been trying to lose weight, it's going nowhere. Yes, I know it's going nowhere. It's going to take you 1 to 2 years to get that. And these are well-proven studies to change the diet and to change habits that become perpetual. So do not give up. Do not take out that kitchen strainer. We don't take out the kitchen strainer. We leave it there all the time. So I want people to persist in lifestyle modification. That's your only way out of reducing the burden of cardiovascular disease. Number two, when it comes to chest pain, even though there are like some very characteristic things related to chest pain, like Dr. Anand said, you're having chest tightness, you are sweating, it's going into your arm, oh boy, I feel I'm going to die, I'm short of breath, etc. These are classic things, classic textbook. But a lot of patients don't have that textbook type thing. So I tell my patients, don't forget when you also having arm heaviness, when you have that indigestion that seems to be made worse by exercise, when you have that upper back discomfort between your scapula, your shoulder blades, that seems to be worse when I go up the stairs. You want to be conscious of that. If you are not sure about any symptom in your chest, I tell my patients, do something. And that do something that, like Dr. Palu said, it depends on where you live. It doesn't mean you go in all the time and physically be seen by a doctor. It could be a phone call based on where you live to an emergency room and say, these are the symptoms I have. Do I need to worry about it? Or it could be a trip to the polyclinic. Or it could be a trip to your local doctor who is not there, but there's a nurse there all the time who can tell you this may be something or this may be nothing. Okay, so you want to make contact with the healthcare system when you have these symptoms of that look like a heart attack, that look like a stroke. We talk about FAST. Time is muscle, heart muscle does not regenerate. Time is brain, brain tissue does not regenerate. That is the fuss about this whole thing. If we could generate brain tissue, nobody worries about, you know, I got a skin scald or I have an injury to my skin. Well, we are able to fix it most of the time. This is time. If you are not sure, contact somebody. Because once you lose that heart muscle, you are not getting it back. Once you lose that brain tissue, you may not get it back. And that's my take on this.
Awesome. Amazing. Thank you. Dr. Apalu.
Yes, so I think they've said it all. I think it's been a very useful and engagement. And I thank you for adding me to this. So I just want us to remember that 1 in 4 adults will have a stroke during their lifetime. It's your responsibility and your rights and it's your responsibility now to reduce that risk. So exercise more, lower stress, reduce stress, take a holiday, reduce your responsibilities. Lots of things you can do to reduce stress. Stress is huge, and we need to reduce stress. So find ways, find local ways, take a walk. Don't let the sun go down on your anger. I don't want to be preaching now, but there are lots of ways. Learn to forgive, say sorry, don't live beyond your means. Have one wife, and stay. Don't owe a landlord. If you don't want to start building your own house. Or as I said, live in touch.
Stay away from lions.
Yes, yeah, stay away from lions of this world and just relax, be happy, laugh, and reduce, check your numbers, know your numbers. Everybody must know what their blood pressure, their cholesterol, their blood sugar is, and their weight and then their height. Know your numbers, reduce this, do everything in moderation. And hey, 2021 is coming. You should see all of us back. And I think it's been a good meeting. Thank you more than Jonathan for calling me.
Oh, thank you so much. Thank you so much. Thank you, Dr. Albert Akpalu. Thank you, Dr. Frank Ado. Thank you, Dr. Patience Anna. And thank you, Dr. Jonathan Lai. I think you all agree with me that we do need a part 2 of this, because we didn't quite exhaust our questions. And when I've just been on Facebook briefly, people are in so much praise of you for making time. Everyone finds it really informative and really educative. So thank you once again for spending your Sunday evening with us, Dr. Ado and Dr. Akpalu especially. We really appreciate this kind gesture. Oh, someone says one of the best sessions so far. So that is really good.
Oh, that's good.
You know what, Dr. Akpalu, I loved your album that you presented on the show.
I'll send you some.
And I'm
I'll send
already
you some
thinking
online.
how can I recreate this dish?
I think he likes the album. Yeah.
Wait, which region is that dish from? Is it from the north?
No, from Ashanti region. So traditionally,
Yeah.
I'm an Ewe, but my wife is from there. So I love that.
He's
benefiting.
So yeah.
So
Thank you so
can
much.
I, Miss Lai, can I say something, Miss Lati?
Yes, please, in 1 second.
So, yeah, 1 second. The one thing about the stress bit is being studied, 2 large studies across the world, okay? And they ask a simple question. We know that stress causes cardiovascular disease. What are we going to do in everyday life? And this was a simple answer. When you wake up every morning, say to yourself, 3, 4, 5 things I'm grateful for.
Right.
What am I grateful for? And that was the most helpful thing in that world study. 2 studies across the whole world, several thousands of patients, okay? So it applies to the US as it applies to Ghana, as it applies to Asia, everywhere. It's a human thing. We all worry. But when you wake up every day, ask yourself, what am I grateful for? I'm grateful for knowing my family, a roof over my head, food to eat. I'm alive. I'm alive.
Yeah.
Okay. And you reflect on that, you are able to move from your.
So Frank, I also read an article that the 10 commandments in the Bible is a good recipe for reducing stress. Thou shalt not covet thy neighbor's property. Do not covet what does not belong to you. Respect your parents. Honor thy father and their mother. A lot of people are not doing that, and that is a source of stress. And
right.
And thou shalt not use the name of the Lord thy God in vain. That is
in vain.
Do not steal. Do not lie. Do not commit adultery. It's all there. It's a recipe for reducing stress. So let's go by that. And then.
Thank you.
Yes.
Oh, I have fantastic. And my take-home message is that when you wake up and you give. So when I call my mom, I'm going to say to mom, good morning. Have you checked your numbers? Have you checked your blood pressure? And I think that was really resonating with me. So awesome. Thank you. Thank you. And yeah, I think on that note, we've come to the end of tonight's session. We want to say thank you to our viewers who joined us yesterday for our book launch, for our e-magazine launch, and for the virtual launch of the Wisdom Academy. I believe that you were really blessed by the session, as we were. We have been so blessed again by tonight's session. I'm not sure what topic we are doing next week, but definitely we are on next week. Next week at 7:30, Pastor Samuel will be on, and please make a date with us again. Thank you, and God bless you. Please stay on whilst I go off live. Off Facebook. Thank you.